We're going to Uncle Sir Fried Rice, your favorite.
No thanks. I'll be fine. I'll stay at home today.
Are you sure? Yeah, but we have food at home, right?
Yeah, it's okay. I'll be fine.
Sure?
Yeah, I'm sure.
Okay.
Bye. I feel so hungry right now, and I gained so much weight. But I can't control myself. Let me order something.
真美丽 fried rice for 真美丽
I feel so bad for eating all of that food. I shouldn't have eaten all of that food. But I couldn't control myself. I look so fat right now, and Shine and Rafida won't like me anymore.
Really, are you okay? You've been in the toilet for so long.
Can I talk to you for a second?
Okay, sure, come.
Meili, we have been noticing that you have been anxious after eating and have been going to the toilet a lot.
Yeah, is there anything we can do for you?
Actually, I've been eating a lot of food uncontrollably lately, and after that, I have to vomit everything out because I feel so guilty after eating all of that food.
Do you want us to follow you to see someone professional about this?
Yeah, I would appreciate that.
Hi Meili, how are you feeling today?
I'm fine.
You have missed a few of our appointments. Are you really okay?
Actually, recently, I've been feeling weak and tired.
What's the
Nervosa is a serious eating disorder where a person eats a lot in a short period of time and then tries to get rid of it by making themselves vomiting, over-exercising, or taking laxatives, which is a medicine that helps with pooping. The prevalence rate of bulimia is higher in women with up to 3% compared to 1% in men per 100,000 people from the year 2011 to 2021. According to the Institute for Health Metrics and Evaluation in 2019, an estimate of 0.12% of the Malaysia's population were affected by bulimia. Includes 0.1% in men and 0.12% in women, which is approximately 4,000 individuals in total. In Malaysia, young adults aged 20 to 25 years old were mostly affected. However, many cases have gone undiagnosed due to the stigma and the strict diagnostic criteria.
Patients with bulimia nervosa might show other signs. The first signs would be behavioral signs like frequent bathroom trips after meals, secretive eating behavior and social isolation, secretive. Certain diagnostic criteria must be met as stated in DSM-5 for bulimia nervosa to be diagnosed. So there will be two different repeated episodes that could be presented in bulimia nervosa. The first one would be the feeling of eating as much as they can or want without any control over them, whereas the second would be eating a larger amount of food than a normal person could take within the 2 hours. There are levels of severity of bulimia nervosa: mild, moderate, severe, and extreme. Hence, doctor will take more holistic approach by combining the DSM-5 criteria with physical and laboratory tests to provide an accurate diagnostic of the condition.
Hi, I'm Kwan, and I would like to share some of the causes of bulimia nervosa. So researchers are not sure the exact causes of bulimia nervosa. Researchers are suggesting a combination of behavioral, psychological, biological, and societal factors. So for example, family dynamics can affect a person because certain family members may be a bad influence and be a bad role model to other family members, which can lead to other family members suffering from eating disorders such as binging and purging. Also, other family members can be a source of fat shaming, and this can lead to depression and anxiety among a family member. Additionally, certain societies may glorify certain body types, body weight, and body shapes, and this can be interpreted as societal cultural pressure, and over a long time, this can lead to a victim having the impression that they are not good enough and need to look like celebrities or models that are very slim. And so over time, this can build up and lead to victims to suffer from eating disorders such as bulimia nervosa. And lastly, social media can play a role in causing eating disorders such as bulimia nervosa, as a study from the Eastern Ontario Children's Hospital Institute has shown that a reduction of use of social media can reduce the incidence of bulimia nervosa. Therefore, it is important for us to continue research on the causes of bulimia nervosa to help victims suffering from eating disorders such as bulimia nervosa.
Bulimia is not just an issue of eating habits, but it has long-term consequences on both physical and mental health. Frequent vomiting exposes the mouth and throat to stomach acid, leading to chronic sore throat and gastroesophageal reflux diseases, which causes painful heartburns. The acid also erodes the tooth enamel, increasing the risk of tooth cavities and gum diseases. Frequent vomiting can also result in the loss of electrolytes, leading to dehydration. This often causes fatigue and dizziness due to the reduce in the blood volume and pressure. Prolonged use of laxatives can also inflame the intestinal walls, causing constipation and difficult bowel movement. This can result in long-term digestive issues such as stomach pain and bloating. People with bulimia often struggle with intense emotions such as stress, anxiety, and low self-esteem. With it, they may binge eat, which creates a vicious cycle of binging and purging that can worsen their emotional distress.
There are no specific cures for bulimia nervosa. There are two types of therapies that are recommended for different age group patients. This includes cognitive behavioral therapy, CBT, for adult patients, and family-based therapy, FBT, for adolescent patients. These therapies have been proven to be the most efficient for their respective age groups. Now, CBT, the counselor or therapist will help the patient understand the way they think, or identify and rectify any problems with the way they think about their bodies and with the relationship with food. The counselor will educate the patient on the condition, the consequences of the condition, as well as help the patient build and learn healthier eating habits. The counselor will also teach the patient how to reduce unrealistic concerns about their body image, as well as plan to maintain their improved condition and to prevent future relapses. Meanwhile, in FBT, the family of the patients will play a bigger role in their recovery. Parents will learn how to nourish their child back to health, teach their children to have better autonomy over their preferences and food choices, while learning how to integrate their child back to normal life once the therapy has ended. If you feel like you're experiencing any symptoms of bulimia nervosa, immediately reach out to a trusted doctor, counselor, or other mental health professionals. In Malaysia, these therapies can be obtained from multiple places, including government hospitals, private clinics, as well as other mental health associations, including the Malaysian Mental Health Association and the Mental Illness Awareness Support Association, better known as MIASA. MIASA also provides free therapy for patients from the B40 community. If you feel like you just want to talk to someone at this stage, feel free to reach out to a close companion or to any of the helplines listed, such as the MIASA Crisis Helpline and the PT Foundation Helpline. These resources will be linked in the captions below. Although it may seem difficult, a full recovery from bulimia nervosa is completely possible. If you are battling any of the symptoms with the condition, or if you are supporting a loved one with this condition, I hope this video gives you the courage to seek help and get better. Meanwhile, for others, I hope you've gained extra knowledge and learned how to empathize with those battling eating disorders, especially bulimia nervosa.